Good morning or afternoon, wherever this presentation may find you. My name is Aminata, but people know me as Amy, and this presentation will discuss the post-operative nursing management of Amara, a 43-year-old female diagnosed with stage 3C invasive ductal carcinoma. Following diagnostic investigations, Amara underwent a modified radical mastectomy with axillary lymph node removal. This presentation will outline the pathophysiology and risk factors associated with breast cancer, as well as priority nursing interventions related to pain management, wound care, and discharge planning. Evidence-based nursing care is essential in supporting recovery, reducing complications, and promoting Amara's physical and psychosocial well-being following a surgery. So, what is the disease? Amara has been diagnosed with stage 3C invasive ductal carcinoma following identification of malignant cells within the right breast. Axillary lymph nodes in the chest wall tissue as well have been affected. Invasive ductal carcinoma is the most common type of breast cancer, and it occurs when abnormal epithelial cells originating in the milk ducts undergo uncontrolled proliferation and invade surrounding breast tissue. In Amara's case, the spread of malignant cells to the axillary lymph nodes and chest wall demonstrates advanced local disease progression, contributing to her stage 3C diagnosis. Breast cancer development is associated with several risk factors, including increasing age, female sex, genetic mutations, hormonal exposure, and lifestyle factors. Although Amara has no known family history of breast cancer, genetic testing identified a BRCA1 mutation, significantly increasing her risk due to impaired DNA repairing mechanisms. Women over 40 years of age also experience an increased risk to breast cancer due to hormonal exposure and age-related cellular mutations. Amara's symptoms of nipple discharge and a painless breast lump are common clinical signs of breast cancer and contribute to early investigation and diagnosis. Early identification and treatment are important in reducing disease progression and improving patient outcomes. So, how do nurses manage pain? Effective post-operative pain management is essential following modified radical mastectomy and promoting recovery for overall well-being. That is for mobility and psychological well-being as well. Amara reports of experiencing pins and needles sensation around the axillary region with surgical nerve disruption following lymph node removal. One priority pharmacological intervention is the administration and regular evaluation of multimodal analgesia. Donaldson et al. 2024 identifies that acute postoperative pain following mastectomy is highly prevalent and may contribute to persistent pain if inadequately managed. Regular pain assessment using validated pain scales allows nurses to evaluate analgesic effectiveness and monitor adverse effects such as sedation, respiratory depression, and nausea. Appropriate analgesia also supports early mobilization, deep breathing, and exercise, reducing the risk of post-operative complications. A priority non-pharmacological intervention involves patient positioning and supportive comfort measures. Following mastectomy, careful positioning using an arm pillow may reduce tension surrounding the surgical site and minimize any discomfort. Relaxation techniques, reassurance, and emotional support may also reduce anxiety-related pain. Frost et al. It identifies that women undergoing mastectomy value compassionate nursing care and emotional support during the post-operative period. Providing a calm environment and involving Amara in discussions regarding her pain management may improve her recovery experience. These interventions are particularly important as Amara remains responsible for caring for her 4 children while maintaining an active lifestyle. Effective pain management therefore support both physical recovery and psychosocial well-being as well. How do nurses manage wounds? Well, post-operative wound care is essential following modified radical mastectomies to reduce complications and promote healing. One priority nursing intervention is a regular wound and drain assessment. Amara currently has 2 wound drains placed following her surgery, which assist in preventing fluid accumulation on seroma or seroma formation as well. Nurses should monitor drain output, color, consistency while assessing the surgical site for any redness, swelling, or excessive pain, warmth or abnormal drainage as well. According to New South Wales Health, ongoing wound monitoring supports early identification of infections and promotes a timely intervention. Drain output is also important to monitor healing progression and communicate to the patient the status within the multidisciplinary team. A second priority intervention involves lymphedema prevention and patient education, and the removal of axillary lymph nodes that can disrupt normal lymphatic drainage and increase the risk of breast cancer-related lymphedema. Pillar explains that lymphatic drainage following breast cancer surgery may result in chronic swelling, discomfort, and reduced upper limb function. Nurses should therefore educate Amara regarding arm precautions, including avoiding trauma, infection, and excessive straining to the limb. Gentle arm exercises and early mobilization may also assist in lymphatic drainage and reduce any stiffness. Swami further identifies that the disruption of lymphatic pathways contribute significantly to lymphedema and development of following breast cancer treatment. As Amara enjoys bushwalking and caring for her young children, maintaining upper limb function is important in supporting independence and quality of life. What does the patient need to know before discharge? A clear discharge education is essential to support Amara's recovery following her modified radical mastectomy. So Amara should be educated on recognizing signs and symptoms and seeking help to promote safe recovery and breast cancer surgery. Following her breast cancer surgery, some psychosocial support include multidisciplinary care as well, and also contributing to the component of her discharge planning. A physiotherapist may assist Amara with shoulder mobility exercises and functional recovery following her surgery, while oncology specialists continue to ongoing cancer management and surveillance. Referral to counseling or psychosocial services may also benefit Amara. So with all these supports, she is able to further support her 4 children while recovering for her surgery. In conclusion, effective evidence-based nursing care is essential in supporting recovery following her modified radical mastectomy for stage 3 breast cancer. Appropriate pain management, wound care, lymphedema prevention, and discharge education in regarding to complications promote healing and improve Amara's physical and psychosocial well-being throughout her recovery journey. That concludes my presentation.